Good morning. We are 4 minutes after 10:30. And as many of you know, we have not had an allied health meeting in this type of setting in a very long time. It's time for us to regroup and kind of share what's going on at our individual institutions, and to also look at opportunities to partner with each other with all the work that's going on around in the area. Lots of folks requested that I schedule this meeting, and we're about 4 minutes in, and I expected to see more people, specifically those who requested to schedule it. So I'll keep an eye on the room and make sure folks can get in. I was planning on starting us off with introductions, because I also know that over the past couple of years, we've had new people take on different roles, but we're comfortable. Everybody pretty much know each other. So if our meeting grow, then at some point we'll do the introductions. Now, with that said, the next thing on the agenda is to talk about partner and grant updates. And wanted to see if any individual have any updates that they would like to share that's related to this topic. And if you have updates that you would like to share, raise your hand, and then we'll just go in order. Give you guys a few seconds. Okay, I'm not seeing anybody with hands raised. And oh, there you go, Gladys. Go ahead.
Good morning, everyone. Gladys Franco from SCCC. So we do have some grants that we are utilizing to support the CNA community members interested in CNA. We have the Education and Training Fund, and we also have a train grant directed towards this effort. So whereas last year we were offering CNA only during the day from 9 to 2:30, now we're also offering it in the afternoons from 3 to 6, in the evenings from 6 to 9 on Fridays, and we're going to be starting a session on Saturdays as well.
That's wonderful. Thank you. And how is it going with CNA training, with enrollment, completion, and certification? How is that going?
So I think that we've definitely experienced some challenges, especially in not so much the recruitment, because a lot of people actually sign up for the class, but it's really in the enrollment, right? Making sure that our participants are ready to start. So we have quite a few people that tend to drop off in that process while we're trying to get them to submit the documentation necessary to be able to successfully participate in the program and the clinical. So that is an area where we need to put a little bit more focus, I would say, and support so that our participants can be successful through that and really have better access to the program. And once they're in the program, we've experienced that a few participants have needed a higher level of support. And so, again, I think the lesson there is doing a better job of vetting the participants and really understanding what their needs are before they start the program.
Yeah, I've experienced the same thing in another program too. And I came to an event at SPIC, maybe about in December or November, and that was the opening of the new simulation center for CNA. I don't know if everyone know about it. I don't know if you want to give the group an update about that, the simulation center.
Yes, we have a new state-of-the-art CNA lab in our workforce development area. And we just opened it in August, had our official kickoff in December. But it's a great facility. We have 6 simulation patients and the technology necessary to really engage our students in this 21st century learning for CNA.
And there was a question in the chat around challenges around licensing. What's your experience with the CNA program?
Challenges around licensing. Well, I mean, I think if you had asked me this question,
testing. Yeah, I'm curious about testing, and is there continued backup?
I think 3 months ago there was, but I think at this point, it's a lot easier under the new company to get our students to get in for testing. So it seems to be no longer an issue.
Elizabeth, you're on the call and you are also a trainer for CNAs. What is your experience? I don't know if you can hear me. I know, Karen, that in, there she unmuted, but I know in another meeting, in the LPN workforce meeting, I did hear that it's a challenge for some trainers still, where folks are completing the training and cannot sit for testing and get their CNA certificate. Elizabeth, do you want to chime in?
Sure. I don't have any students that are waiting at present, but I think our workforce side still does have quite a bit of a backup. that they're
Elizabeth,
trying to get
what
But-
training program are you from? Sorry, I'm not familiar.
Sorry, I'm calling from my phone, so I'm having a little bit of trouble hearing, but I'm at Holyoke Community College.
Okay, thanks.
Sure.
Go ahead, Gilberto.
But I think as we get
Oh, no,
more
she's not finished, sorry.
testers. Oh, sorry.
Go ahead,
I was just
Elizabeth,
gonna
I'm
say,
sorry
I know
about that.
there are now more. Sure. I was just gonna add that I think there are more testers now available or imminently becoming available. So I think that will help significantly.
Well, when you say testers, do you mean
That's all. Thank you.
inside? You're talking about testing sites, right?
Sorry, I'm having such a hard time.
I know. It's okay, it's okay. I won't put any more pressure on you, especially with the fact that there's the challenge with the technology. But I'll pose the question to the room after. Gilberto, you wanted to add something?
Yeah, just real quick, and thank you everyone for having me here today. I kind of transitioned from being with a home care agency and working with a lot of the home care agencies and looking at how we can transition home health care aides into CNA programs or nursing programs. We've had this discussion a lot around, supporting the whole healthcare providers system and creating a feeder system. Also talking with a lot of students or potential students out in the community, because I'm doing business coaching for under Mass to Miami Consulting Group, and working with a lot of students or people out in the community that used to have CNA licenses and want to come back. They have to renew and things like that. Having that information, and the fear is for all of them is that test. And they're all fearing wanting to sit down to take the test. And I'm like, well, you did it once. Why won't you go do it again? But there is, even for the ones who haven't passed it, they put in the time and they say it's like a roadblock. So I don't know. I think Gladys says something very important about when we look at the students and we talk with the students and we work with them, it's kind of meeting them where they're at and getting them to not just be prepared for the test, but also emotionally be prepared so that they're ready to move to that next level. Because I think when we talk about social emotional learning, it helps our students to really go beyond that it's not to break that fear factor, because that's one of the biggest things. So I do a lot of coaching with workforce development, do a lot of workforce development training for people outside, and we're feeding people into that whole healthcare system as well. So I show them the steps, CNA, nursing, the levels that they can go to, and the different opportunities that are there for them. So I know that I have a group like this, and it's an abundance of resources. We have the two schools and the nursing programs and everything else. I think it's great. So as I talk to them about businesses and talk to them about potential gains for themselves, this is one of the pathways for them.
So there are several questions in the chat and we'll just kind of move down through them because I know that, let's see, Karen, Karen Russo, you talked about what are the actual barriers with, participating in the program. And, I think that question was posed to possibly Gladys when she mentioned, some of the challenges, and I think they're academic preparedness gap. Gladys, what exactly are they?
There are some students that struggle with academic preparedness. I would say that that's not the majority of the students, and we support students with other needs that they might have as well. They haven't, those have not shown up as much. I think the biggest challenge for us right now is really making sure that they're ready to start the program.
And when you say ready to start the program, you mean like they're feeling that they can actually enroll and finish. That's what you mean, in the sense that.
Yeah, I think it's both, right? Because when we think about like the academic preparedness, that's a piece of it, making sure that we are pre-assessing the students and understand what really, what are their needs and are they ready for this level of work? Or is there another route that they should take before they even start the program?
So is it social barriers for them? I guess that's what I'm trying to, what are you using to determine whether they're ready? Is it that they have plans in place so that they can be available at the set class hours? Do they have transportation issues? I'm just curious as to how you make that judgment.
I mean, I think that's really a one-to-one conversation with the students, right? So every student is going to experience at least one of those factors as a potential barrier. And so for us to do a better job of communicating with the student from the time that they register and make sure that they are, they have what they need to begin is but I think the next step and where we need to really focus our energies, because there's no point in enrolling 30 students and only having 10 begin or even less.
Well, and you're holding a space for somebody that isn't going to show up too.
Right. Mm-hmm.
On that question too, Karen, just based on the programs that I'm overseeing through the hub grants, some of the things that I observed or I've seen with individuals going through the training is that when they come up on a barrier, doesn't matter what that barrier is they see the barrier but do not see solutions. And so they stop going to class, they stop communicating, and they don't say, this is the issue that I'm having. They come up with a solution where I have this issue and I can't go to class. And then you do the reverse work where you're like, okay, you didn't come to class. What's happening? And then they relate the barrier and they say, well, there's a solution for that, you know? And so I think too, when I'm observing working with the trainers, that it's great when you can put in a orientation that addresses a list of common barriers and say, this is what you do when this happens. But it's also to track in each student going into the class, and when they don't show up, say, hey, you missed class today, what happened? This is the assignment that you need to make up. This is what professor said. And then they start communicating. But I don't know if anybody else have experienced that, but those are some of the things that I'm seeing through working with 5 different trainers and seeing individuals going through the training. Have any of you guys implemented any solutions around that besides the examples that I shared? Okay. All right, moving now to the next question. And Karen asked us if we're familiar with refresher courses available in the region. So first, it sounds as if we have refresher courses in our local area. And then which courses are those? Where are they offered? Does STIC or Holyoke Community College have refresher courses for CNA?
No, we do not.
Let's see. We have one HCC person and she can't hear us, so I don't know. Karen, do you know of the refresher courses in our region? Karen Shack? No. Gilberto, do you know?
I thought I saw on the American Red Cross that they had one, but I don't think it's local. I don't think it's local. I thought that they had refresher courses, but they're more like out towards the Boston area. Because they have a whole bunch of different offerings, but they're really not locally here. And I haven't seen any other refresher courses that would also accommodate the population that I would be steering in that direction. You know, we're talking about linguistics and cultural and all that I'm trying to get to go to take those tests. And I'm not sure if that would work out for them.
So this is Karen Shack from Commonwealth Corporation. I'm sorry because I don't know everybody, so I don't know exactly what organizations everyone's from. Could I ask when you speak, if you wouldn't mind just saying what organization you're from? That would just help me.
Let me pause, Karen, and follow up with that, and let's just do our introduction so that we'll know who's in the room. So
Okay.
Gladys, will you start for me, please?
Of course, Gladys Franco, Assistant Vice President for Workforce Development here at SDCC.
Thank you, Gilberto.
Gilberto Amador, President, CEO of Mass to Miami Consultant Group.
Thank you. Judith?
Hi, Judith Kosick from Franklin, Hampshire Career Center.
Thank you. Karen Russo.
Karen Russo, the Dean of the School of Health Sciences at AIC.
Karen Shack.
Karen Shack from Commonwealth Corporation.
Peter Blaine.
Peter Blaine, manager of the BSET program at Bay State Medical Center.
Thank you. David Cruz.
Morning, everybody. Thanks so much for making time to join us today. Dave Cruz, Nassau-Hamilton County Workforce Board.
Kelly.
Good morning, Kelly Gutkowski, Assistant Dean for the School of Health and Patient Simulation at Springfield Technical Community College.
Thanks, Kelly. Tony.
Good morning, Tony Hendricks. I'm the Director of Human Resources for the Loomis Communities in the Pioneer Valley.
Thank you. Rebecca.
Hi there, Rebecca Bielecki with Franklin, Hampshire Workforce Board.
Beth. Okay. Does anybody know which organization Beth Healy is with?
Beth is with me from the Loomis Communities.
Thank you. And Elizabeth Hayward is from Holyoke Community College, and she teaches the CNA program. Karen, were you going to back that up with another question?
I just want to ask why there are no refresher courses that you all are offering. Is it because you don't have funding, or are there other barriers to offering refresher courses?
I had not identified it as an issue, honestly. I don't think funding is the problem at this moment.
And I'm going to go ahead, Karen. You unmuted. Go ahead.
I mean, do you all think that there is sufficient demand for us to propose that additional refresher courses should be offered? We have funding for that kind of thing. So I just want to make sure I understand. If you're identifying people who need a refresher, but if there's no options for refreshers, I just want to make sure I understand if you feel like there's demand.
To be honest, we need to dig a little bit more into the data to give you a good answer on that, Karen. I think it's possible that some people might benefit from it, but from what I know about our programs is that most students are able to complete the process upon completion of the course. They're able to get their licenses soon thereafter. But more, I'd have to dig into it and get back to you on that.
Can I ask, why would you need a refresher? Is that somebody who finished the course and never tested? Or is it somebody who's been out of the workforce for a while? I'm confused.
It could be both.
Both.
It could be both. People who had their certification and just haven't worked in a while and want to get back, or just by chance, 2 years of COVID hit and they haven't done nothing and their license expired. I mean, I thought that there was a provision for them to be able, during COVID, to be able to just get their reinstatement at that time. But a lot of them have said no, that it hasn't. They had to retest, or they had to do the whole class all over again to then get to then test. And they say that it's anxiety provoking to have to sit again for the whole class to then test again. So that's why I feel that, yes, sometimes maybe the refresher courses would be a good thing. And I also thought about, and maybe to what Karen just offered or said, the collaboration with maybe community organizations that can offer maybe the relationship between the schools or the medical facilities, offering this at a community location where people can go and do the refresher or the class, so that there's some comfort in where they're going. Some of the people just don't feel comfortable going into an institution to do these classes. That's just, I'm just putting it out there because it's things I hear, and working with different people who can possibly be doing a CNA program and graduating out of a CNA program.
Kelly?
Gilberto, I just wanted to confirm with you. So are you saying that a refresher course is necessary for everyone whose license has expired?
I'm not saying it's necessary. I think that they have to then, their license could be expired. They have to go test again. So that to do that, there are two options. They can either sit a whole class all over again and then go test, or they can have a refresher course and they could go test.
Okay, so if their license has expired, which everyone's will at some point, I don't know how long they're good for, but everyone's will at some point, they have to retest each time.
Right.
Okay.
No, I think I'm hearing something else. No.
Yeah, and that's what I'm trying to clarify.
Can't they just renew?
So let's
it's after a
clarify.
certain amount of time.
Let's clarify that. Peter, maybe you have, I think there's a misunderstanding here. Peter, do you want to chime in and then?
If you're working, it will, you can renew it. If you don't,
Yes.
if you're not working, it will lapse on you. But if you're
Yes.
working in the field, you don't need to retest.
Because you're probably submitting CEUs or something, correct? Okay.
Exactly.
The work experience, yeah. So so let's kind of back up, because I think we are all on it. We're all on the button, and that's the place that I think we should kind of think through about the need for refresher courses. And so I think there was always a need for refresher courses, but that amplified at the point when there was a crisis around certification of CNAs. That's when folks were graduating and did not have the opportunity to sit for the test. And at that point, they were able to work under certain provisions during that time. And I think the last conversation that we had in this venue, there were discussions around developing refresher courses, because there was such a long lag between the time that they completed the training and then sat for the examination. What we haven't captured that I'm aware of in our region is what's the need, as Karen asked. Are there still a lot, realistic numbers or the actual number, are there still a lot of folks who are completing training programs and waiting an extended period of time to test? I think that's one question that we got to figure out. And then the other one is there still an allotment? And I'm leaning on you, Tony and Beth, because you guys are the employers and would have more knowledge about this. Is there still an allowance for folks who completed the training? Because before, my understanding was prior to this, that any person working as a certified nurse's assistant needed to be certified. So is there an allowance now for people who completed the nursing assistant training to work in some capacity until they sit for the exam? What's going on in the employment world, Tony?
You know, I have to admit, I don't have the exact date. I want to say April, that the extension has been extended until April, that they can continue to work without a license. But right now, I think I still have a couple of people from my CNA training classes with HCC who haven't been able to sit for a test in over a year. or maybe they're just now sitting for a test in over a year's period of time. But my understanding is that the period of time to operate without a license is going to be expiring very soon.
Yes, and Tony, previous to the testing crisis, no person was able to work as a CNA unless they were certified.
That in a nursing facility or long-term care facility, yes. Of course, you can be a home care assistant or a home health aide or a home care companion, not a home health aide, a home care assistant or a home care companion without a license. But in order to work in assisted living or a nursing center or a long-term care facility in Massachusetts, you must be certified.
Wasn't there like a 4-month time after your training that you were allowed to work in a nursing home before you took your licensing exam?
If you could prove that you were, if you had a sit date, you know, and sometimes that sitting date was, you know, a 3 or 4 month window, then yes, but you weren't, you know, we weren't allowed to just keep you on indefinitely without a license.
And not just that, Peter Gay, I respect how you just organize that and put them into their silos, but I'm also thinking about like what I'm saying is also the people coming in, the feeder system. How are we tapping into the new healthcare providers that are going to come in, or the other people outside that are looking for jobs, that are looking to get into the workforce? Because that's what I'm seeing too. People wanting to come back into the workforce, and how do they want to do that? And picking healthcare as where they want to go.
Well, and Gilbert, I totally agree with you. I mean, you know, I put ads out there on Indeed for, I'm starting a new home care agency, and I put ads out there for, you know, home care companions and home care assistants and licensed, some not licensed. The number of people who I get who do not have a CNA or a CPR license is just, it's overwhelming. But they have been working in the home care industry or the home care, you know, field. And so there's a huge misconception about the difference between home care and what's allowed in home care versus the EOEA regulations for assisted living and the
Right.
DPH regulations for nursing facilities.
Right.
Yeah, absolutely, absolutely. So, taking a step back and moving forward to Gilbert's point, because it is really important and something that we have to focus on. When we take a step back and we ask the question about who would qualify for a refresher course, anyone who feels that they need to. At what point does your license expire? As long as you are a certified nurse's assistant, I hope everybody move forward with me on this. And if I'm incorrect, let's correct it so we all are on the same page. Once you become a certified nurse's assistant, as long as you are working, your certified nursing license is current.
No. Your license will expire every 2 years.
Okay.
Period. Whether you're working or not, your license will expire every 2 years, and you have to reapply for your license every 2 years.
But you don't have to retest. You don't have to retest.
You don't have to exactly. You don't have
Right.
to
You don't have to retest, but you have to, you know, renew your license every 2 years.
But if you haven't renewed it, you still get in those CEUs if you're there, but also the agency takes the risk that you are not licensed, that your license expired. So they do, you know, after the certain time, they don't pay it, and they run into that problem of, hold on, I'm not legally licensed. And regulations in the state of Massachusetts are just regulations. So there are things that we have to keep people with that. They have to be thinking about that as well.
Yeah.
Yes. Beth, I heard you say something. I'm not sure if you wanted to chime into this conversation at this point.
No, I just, you know, I agreed with Tony. They do, you know, it's every 2 years. And I did see someone just put something in the chat, how many hours they have to work. When they fill out, when the supervisor has to fill out a form to go to the CNA registration, it's 8 hours.
Okay, wonderful. All right, so everybody's on the same page now? Are we, yeah, we're all there. Perfect. And thanks for that clarification, Peter.
But
So
I do have a question. Don't they also need to get a certain number of CEUs during that two-year period? That's not required, Peter. It's just they have to work at least 8 hours during that 2-year period, and then they can apply to have their license renewed.
renewed, yeah. Yes, but then if they don't meet those certification, then they have to. Previously, I wasn't aware that there were refresher courses until recently. So if they messed up and did not recertify, they would have to take the whole course again. So what's the difference now? If a person lapsed on their certification, does the refresher course qualify them to retest and get recertified? Elizabeth, go ahead.
I hope you can hear me. So my
Yeah.
understanding of the tests of what qualifies you is the training never expires. If you take a training course, you pass the training course and you have your certification of completing training, that the training doesn't expire. So you could technically have your license lapse for many years, but you would need to retest. You wouldn't have to take a whole training course from start to finish over again, but you would have to be able to sit for and complete successfully both parts of the state test.
Perfect.
Does that make sense?
Yes. Thank you. So if we go back to Tony's comment, where she talks about individuals who are looking to apply for looking to apply to work as a CNA with home health care experience, they would need to go through a full CNA training program according to state regulations. Yes. But any person,
And sit for the test.
yes, but any person who have, as Elizabeth put it, caused their certification to lapse and need to sit for the test again to become recertified, not go through the training program, but need to resit, they would qualify for a refresher course. And I'm saying that to kind of help us think through evaluating the actual need for a CNA training and a refresher course, right?
Well, I think if I understand Gilberto correctly, I think what he is alluding to is people who have let their licenses lapse. So they were certified CNA trainers, certified CNAs. They allowed, for whatever reason, their CNA license to lapse and expire. So they can retest, but what many of them are saying is they would like a refresher course or some tutoring or some study courses in order to help them prepare to retest.
Mm-hmm.
Is that right, Gilberto?
Yes, that's right. And it's because of that fear factor of going back to test. And they don't want to have to do the whole class all over again. It's just having that refresher. And because some of them have gone into doing business versus going back into healthcare. Right. So now they, with the encouragement of the fact of, hey, listen, you did 10 years as a healthcare provider, and this other stuff is not working for you right now. So where do you want to go?
Well, and I would add to that. I think where we see a lot of the confusion is, I've been working for Stavros for 10 years, right? As a home health aide or a home health companion, or a home care assistant. The titles are very screwed up right now in terms of people understanding, what they're applying for and what the qualifications are for those kinds of positions. And so I was at Stavros for 10 years. I was with one family for 10 years. I took care of them for 10 years. I've been in the healthcare industry for 10 years. Boom, they apply for my job. They don't have a CNA license. Right. And so there's a lot of shock. There's some shock factor going on for people who have been in this industry, but don't understand necessarily the requirements for for working in the different levels of care.
Mhm.
And I'll be honest, I mean, I'm sitting here and all of you that are in the education field, in the corporate field of health, as a business person working with businesses out here and listening to the residents as to what they want to do and having to guide them in a direction that says, look, do you really understand the pathway of healthcare? I want to be a nurse. Okay, well, do you know if you are actually working in a home care agency and you're a CNA and you got this experience, why not sign up for a nursing program now? You're a good candidate. So they don't understand that those kind of things help them move forward. And now they're good potential students to get into a nursing program. And then the other ones that have nothing that like helping people, why don't you try becoming a CNA or a home health aide, these kind of things. So it's really I'm trying to help create that feeder system. So with people, the regular people that are coming into my office every day.
Yeah, that is very helpful to them. Peter, you were gonna say something.
But Karen put in the
Yeah.
chat that really what we're looking at is exam prep, and I think that's absolutely right.
I keep hearing you all talk about how anxious they are about taking a test. And I'm most familiar with prepping nursing students to prepare for NCLEX. And there's a whole giant business industry that's focused on prepping students for NCLEX. It seems like there needs to be a focused effort that once they finish their training, now we're going to give you a 2-day intensive. So you're really ready to go take that exam and then go take it.
Yeah, Karen and Peter, let me add to that because I saw you put that in the chat too. And you just had a review, and I hope I can speak this, but I can't say no, you can't. You just had a review of your nursing program, and David and I attended that meeting. And David was there. I want to tell you that one of your graduates who was given feedback spent maybe a minute to 2 minutes talking about how exceptional the exam prep is at AIC and the product that you use. Am I right, David?
That's correct.
Yeah, they were absolutely just gung-ho about the exam prep. So that I was gonna ask that question too. I was gonna ask everyone, yay, Jeff is coming in. He has a lot of knowledge about health, CNAs and HHA's training programs. So I was gonna ask the question, do we even know what the successful rates for CNA training for the exam? Do we know what those rates are? Like what percentage of people who sit for the exam actually pass? I don't know if we do that, if it's low or if it's high, but I do agree that.
I mean, the state tracks the nursing passage rate. Do they track the passage rate for CNA? Because that's, programs are held accountable for that.
The Red Cross would have those numbers as well. I mean, the testing goes through them.
Not anymore.
Not anymore.
But we do have access to that information. Each program has access to the testing platform that gives us information on the student pass rates. Fortunately, I don't have that on me, but I can get that for our next meeting.
That's helpful. Thank you. So Jeff, I'm gonna just catch you up a little bit. Thanks for joining us. So we're on the topic of refresher courses. Karen Shack asked the question, are there refresher courses for CNA programs in the region? As of right now, we don't know of any, but our discussion so far has led to the point that we need refresher courses for individuals who've been away from healthcare work for a while. And we also need a test prep courses for those who are anxious about taking the CNA exam. So I just wanted to ask you what's your take on that? Are you aware of refresher courses?
Yeah, so we have on and off done some refresher courses, but nothing that's current right now. You know, of late, it's been more about new people coming into the field as opposed to people coming back to the field. I'd be happy to help on that. I think it makes a lot of sense to go in that direction.
And what's your thoughts on test prep for CNA exam for those who are just anxious about retaking the exam?
So we do that all the time in various programs. We do prep sessions, especially, you know, when we're doing a new cohort, but yeah, I mean, we could formalize that, sure.
And Karen Shack says that if we are looking to do a refresher course in our region, that there are funds available to do that. And she's still in the meetings. If you want to chat with her at some point, you guys can discuss that. Anybody else have any comments, anything they wanted to state on this topic?
Well, you know, it's interesting. The only comment that I would add is, you know, we worked with Holyoke Community College to create a very successful internal private CNA training program, kind of feeder pool for ourselves. You know, with about a 60% graduation rate, but that didn't have to do with HCC. That had to do with people and their lives and their ability to commit or not commit. Well, you know, they offer refresher courses and they offer, you know, study programs and many different types of things. But if you can't shorten the length between graduation and actual testing, you just have to do it again and again and again in order to get them ready for the actual testing. So while I think this, you know, preparation for testing course could be really helpful, it's really all about, you know, can we make sure that the testing system is working so that they can sit for the test?
Yeah, absolutely. I think, you know, and maybe Elizabeth could fill in more on this, but I know that we've applied and I think we've been approved as a regional testing center. And so that's just one step we're trying to take to, you know, increase the volume of testing in our region. So.
That's cool, Jeff.
It is, yeah. Are there any other testing centers here? I know previously there were very few.
Yeah, I'm not sure. You know, I do one of those, oh, that sounds like a good idea, go for it.
Yeah.
And that's
And
the level of my detail, I'm sorry.
No, we appreciate it. That's absolutely needed. David, you have your hand raised, go ahead.
Yeah, just quickly, Jeff, I wanted to just ask you, you mentioned that the college has applied as a testing center. What is the status of that application?
Well, I'm pretty sure that it's been approved, although I'm not sure that it's been publicly announced.
Okay, thank you.
And Elizabeth, I don't know if you have a different take on that.
No, I'm not in on that information.
Okay.
The only other thing, Jeff, is we were talking about as Tony alluded to moments ago, the lag between completing the training program and being able to sit for the exam. We heard from Elizabeth and Gladys that now it's greatly improved where there is not a huge lag between folks completing the training and sitting for the exam. Tony did share with us that she has folks who are employed in her organization who have been working and for over a year and have not been able to sit for the exam. Additionally, she shared that according to her knowledge, that allowance for folks to work without certification expires in April. I wanted to ask you, representing the workforce development side of things, side of the college, what's your experience with your training programs? Are people completing and able to test soon after?
Yeah, I mean, we have a backlog right now, but we're whittling it down. And so, you know, I wouldn't say that the problem has gone away, but I would say that we're making a dent in it.
And it's because of an increase, I know yours isn't approved yet. Is it because of an increase of testing sites in the area? What?
I think it's due to the fact that we have testing going on through Elizabeth's program. We have testing going on through our Jumpstart program and testing going on through the ESOL program. So it's that there's multiple avenues for testing.
And what happened to the folks who were backlogged? So the ones who graduated months ago and couldn't test, what's the process for them? That's a question for the room. For all the trainers, if for people who graduated before and they weren't able to test, but they were placed in an organization to work until they could test. You guys know what's going on with there? Do you guys own those students, and are you guys required to make sure those students test, or is it the employer who's tracking those previous graduates?
So I think we're able to track them, and my understanding is that the new company was working with those students that were backlogged to try to get them in as soon as possible into testing.
Okay, all right, and then those could be the ones who'll be interested in the refresher course, should there be one.
In our case at the Loomis Communities, I know that the students who went through the private training class, they have been tracked by HCC and have kept in, constant communication. And there've been some kind of false starts because of testing sites, mostly. So while we are aware of it and we keep track of it because we need to know for DPH purposes who's not licensed on our campuses, HCC has really taken the lead in trying to keeping in touch with those people.
All right, appreciate that. Is there anything in the chat that I missed that we should discuss? Okay. All right, so we were on the topic of updates from all our institutions. And I just want to see if anybody else have any updates that they wanted to share. All right, I think I'm going to elevate several. I had a list of like 9, but most of you are familiar with what I was gonna share. So I'm gonna cross off some of these and share the things that I think that might be interesting that you might not be aware of. So let me go through my list and see if anybody wants to know about. So there is 2 grants that MassHire is administering, funded through Commonwealth Corporation. Many of you have heard this over and over again. Are you guys familiar with the Healthcare Hub grants and the behavioral health? Yeah, all right, good. So I'm gonna check those off. The next thing is that the state recently started a nursing group. It's called the Nursing Council on Workforce Sustainability. Who is not familiar? Raise your hand if you're not familiar with that, and I'll give you an update on that.
Can you say the name again?
Nursing Council for Workforce Sustainability.
I'm not familiar with it.
Okay, so recently there is this new group that's established. It's a statewide group, and it consists of all the major institutions and nursing organizations across the state. Their focus is on, let me pull it up. So their mission is to convene key stakeholders to provide innovative solutions, inform policy, and make evidence-based decisions that ensure health equity by building a resilient and sustainable nursing workforce focused on improving the health and well-being of the Commonwealth. And their vision is to pioneer the future of sustainable, diverse, and inclusive nursing workforce. So all of the major nursing organizations are a part of this workforce group. So the Council for Home Health Care, the Association for Long-Term Care Foundation, all of the nursing councils, the ones that oversees the group for the CNOs at all the hospitals. So every setting is represented. DPH is represented, Mass Department of Education is represented, and they all meet together on a monthly basis. And the primary goal is to improve the workforce around nursing. David Cruz is a member. He represents all the, he represents the MassHire workforce system. He attends monthly meetings and provides feedback to our nursing group. So we have our regional Western Mass Nursing Collaborative. So on a monthly basis, we get monthly updates on activities in that group. Want to say that I would identify that their current focus is on centralized clinical placements. He's asked that I be included in those conversations, and I've attended a meeting so far, the next one scheduled in this week, Friday of this week. And their focus for the centralized clinical placements, which is clinical placements for students. Primarily, all the work has been centered on nurses to date. The group is looking at expanding clinical placements. I went into that conversation expecting them to say that they were going to look at including more nursing schools across the state and including more healthcare providers. Their first step is not that, because that's what we've talked about regionally, but what they're looking at doing is expanding beyond nursing so that all other disciplines would be a part of the centralized clinical placement system. And what that is for all of you who do clinical placements for your disciplines is a central place where you request clinical placement, you put in your request to healthcare organization view those placement requests and place students. So they're looking at expanding that. There are two other work groups, one's for grants and funding, and another one for data and research. David did share with us, those are the groups that are active currently. And I know that he also requested, and Larry Martin was invited to be a part of the data and research committee, but he also shared with us that there's a group that's looking at nursing faculty. David, if there's anything you want to add, you can unmute and give us an update on that.
No, thanks, Peter Gay. I think for today, that was a really good overview. This is a group that is forming and we meet monthly, and the reason we're in a monthly cadence is to try to fast track some of this work forward. And as you can imagine, the council currently has funding through an item in the FY 2023 economic development bill. So is obviously, you know, trying to secure funding going forward to sustain their work. But I think there's significant potential here for this council to do some transformative work. And as Peter Gay said, even though it's called the Nursing Council, I do think there's an interest in the council, you know, getting into a broader healthcare arena. We'll see how that goes. But if this group continues to meet, I'll certainly be more than happy to share information on the meetings with you and through Peter Gay. So if anybody would like to get that, just let Peter Gay know, and I'd be happy to share with you the agendas for the meeting and any other collateral that I should receive.
Appreciate that, David. I'm going to move now to next item, which is an LPN workforce meeting that's meeting regularly. We started in October. We're looking at the LPN workforce. We've all agreed that there is a great need for LPNs currently, and there will be a great need for LPNs moving forward. Much of that is impacted on the change that happened recently where acute care organizations are employing LPNs to work. And so that create a more stress on the supply. And we didn't have a large supply in the first place. We have two schools in our region, or region 2, Pioneer Valley, that provides training for LPNs. And we graduate under 50, much under, between 30 and 40 LPNs per year. So that's the reason for our focus on LPNs. And so far, all of our discussions have been centered around developing a support program, kind of to what Gladys was speaking to. So a bridge program into the LPN classes, so that to help prepare them into knowing what to expect and getting them ready for when it comes. And we also talked about some test prep. We also talked about some social supports. Jeff is a member and a leader of that group and that conversation. I don't know if Jeff, there's anything you want to share in addition to that work.
No, I think that's a good summary, Peter Gay. I think, you know, the whole effort is to see if we can have these nursing career from nursing assistant, medical assistant, all the way through to LPN and then LPN to RN pathways. And so, you know, it's a a combined work and the spirit of the group has been strong in terms of trying to see if we can make something work.
And we have the two colleges represented at the meeting, just so you know, but we're looking for, we are looking to get stronger representation from Greenfield. So Rebecca and Judith, if you just want to just put that in your ear, just to let you know that that's something we're working on as well. Okay, I just put in the chat a little while ago, something that I sent out in the email, the Allied Health distribution list. So I put that link in the chat so you guys can take a look at it. What it is, it's an invitation from Springfield Public Schools. It is a internship fair that they're holding at Western New England University. They're looking to have about 200 students who are Springfield Public School students and also students from Western New England to attend that fair and meet with employers to get positions for internships. The link that I put here, you can use that to register. The event is on March 8th. Next, I received this. Oh yeah, you guys can see it. I received this booklet in my box here at Mass Hire and flipped through it and figured that with this meeting on the calendar, that this would be some useful information for you guys to have to know this available. I don't know if we've already posted it on our David, the version that I have. Okay, good. I have the right version. I don't know if we've already posted it on our website, but if not, I'll make sure that if it is, I'll make sure I send the link out to you guys directly. If it's already on the website. I did look, but I'm not sure if I was looking at the right version. David, is it on?
Yeah, this report was just completed last Friday, so I don't believe that it is up on the site yet, Peter Gay.
Okay. I'm going to screen share. I'm going to walk us through it. If I had the link, I would share, but I'm going to walk us through it just so that you guys can see it, see what's in there, and take a moment to look through it. So what this is work that Region 2, the two regions employment boards are working on, and it's a part of the Pioneer Valley labor market blueprint. You know, that work goes back to, I think, 2018. It was established through Governor Baker's administration and was work being done through the Workforce Skills Cabinet. It's the group involves all of the public education institutions. So STIC is a part of it. Holyoke Community College are a part of it. Jeff, I believe you attend a lot. You're part of a lot of the work that goes on through this. And it represents, as it says here, Regional Community College and Westfield State University. And it's looking at program enrollment and capacity. It has very, very useful information. It's broken down into different sectors, one of them including healthcare and social assistance. So it shows our supply gaps for registered nursing, LPNs, pharmacy tech, medical assistant, patient care tech, physician assistants, OTs, and physical therapists. And this table here is showing enrollment numbers for all of our programs in the area, and it's showing the enrollment compares to the capacity. So if we go back up here, it's pretty self-explanatory whether or not the enrollment exceeds capacity, if the enrollment is equal to capacity, or if the enrollment is below capacity. So you guys can see that whole table. So we have the nursing programs listed at the 3 community college. There's the health science program at STIC, the Foundations of Health and Human Services program at Holyoke Community College. And you can see all the other programs. I'll leave it there for you guys to take a look. And so overall, the takeaway is for most of these programs, enrollments are down. And this is not news to anyone. And then there's observations here that we could, we will circulate this report and have you guys take a look at it. And then there's another sector, which is the healthcare social assistance with certificate programs, and you can see again. And this is a report for Westfield State. At capacity, enrollments are down, and there are observations here. And then we move to advanced manufacturing. But I wanted you guys to know that this work was done, that the data is available for anyone who is looking for information like this. The work has been completed, and there's this resource available to you. Jeff.
Yeah, thank you, PDK, for sharing that. I think that's good information, and obviously the impact of, COVID-19 in terms of our ability to recruit students and to recruit people into programs has been very challenging. I do think that one of the pieces that's tough to see, because, it's not included in this type of data, is the work that Kristen Cole and Gladys Franco and I do on a regular basis on the non-credit side. And so whether it be, CNAs, medical assistants, pharmacy technicians, home health aides, those types of occupations, which are really about trying to build the pipeline. I do think, and I know that information will be available in a different setting other than this particular report. But I think, it's important to recognize the volume of that work, because that seems to be getting larger and larger, and especially with the education and training funds that are available to our institutions. So just an FYI.
Yeah, no, that's great. That's great information to share as well. I have one more item. I don't know if anybody else had any comments or anything that they wanted to add at this point. I have one more item before I wrap up. Okay, so through the work that's done through Pioneer Valley Interprofessional Education Collaborative, this is the third group of the Healthcare Workforce Partnership. The members are made up primarily of the advanced health discipline programs. So OTs, PTs, PAs, medicine. Just want to set that level that in, provide with that information. They are in the process of developing a professional development series for faculty members. And the discussion was around the state of classrooms, their experience with classrooms where students are displaying more anxiety around entering learning, their experience, they are showing more anxiety around going into work. So there's like an overall rise in anxiety in students, and they're talking about managing those classrooms. So they're in the process of developing a professional development series to equip faculty members to deal with stress, trauma. And the title of that series is Trauma-Informed Educational Practices and Emotional Resilient Classroom Spaces. It's an interdisciplinary group. And so far, the members who make up the planning team represent medicine, speech language pathology, and pharmacy. They're looking for more representation on the planning committee. Hence why I'm sharing this information. All health professions are welcome. So if you are interested in attending the meetings, you can let me know. If you can't attend the meeting, but you want to provide input into what should be included or what should be considered, you can share that information with us as well. Additionally, we're sharing this information because once the training becomes available, we would like to invite as many faculty members across the region to be a part of that, series. With that said, that information will be forthcoming for those who are interested, but does it sound like to you as educators as something you would be interested in, and are you seeing some of the things that I just shared in your classrooms for folks who are teaching? Kelly, do you teach? No.
I
Elizabeth, you have your hand raised.
I definitely see that in my classroom.
Thank you.
Yes, that anxiety level for students, and that's what I talked about earlier. There's a lot of students that it's really about addressing the fear factor, the anxiety, those emotions of taking it to the next level. And sometimes it's not about not knowing the information. They get the information. They're ready to test. They're ready to go forward, but that anxiety level doesn't give them that final push.
Appreciate that feedback. Elizabeth, you were gonna say something? Oh, you put it in.
Yes,
there.
yeah, I put it in the chat, but yes, as an instructor, I think any of us, all of us would be interested in better serving our students through more trauma-informed education, especially post-COVID, right? Definitely.
Appreciate that feedback too. The group that's planning the PD, they're in the process of doing research to inform what they'll deliver. And one of the things that they shared with me so far is that when they look at what's been done already, all of the focus is on pre-K through 12. Nothing is on, after for students who have graduated from high school. So I think it's a good space for us to focus in on. And like you said, both of you said, I've heard it through the nursing program too, directly, that they're seeing that students are more anxious overall. All right, I think that covers all the things to share. And primary reason, one of the primary parts of the agenda. So I already thought in my mind that the training programs update, I've asked all the folks who provide training to give me update on overview capacity, course frequency, enrollment, retention and attrition levels, vaccination requirements and processes, vaccination said that, testing and certification, number of graduates in 2022 and challenges. That's important to share. I know we've talked about challenges for the CNA programs. I'm going to ask all of you that you do provide me with that information. I don't think we need to go through it here. I'll show you what I use that for, and you guys should all be familiar with this as well. Sorry, I got lots of messages popping in here. You guys should be familiar with this document. It's something that we keep updated and folks find useful. And one of the things that, as I was listening to Gilberto talk earlier, I think Tony, is we could also clarify in this section who qualifies to work as a CNA and who qualifies to work as a HHA or a PCT. So you guys know, you've been a part of the development of this document and a part of the updating of it as well. It's out of date. Last time was updated in 2021. So I'm just asking for new information to provide me with that new information so I can update this and folks can have access to it. This can be a resource that Gilberto can share with individuals that he's coaching. And I'll follow up with you administrators of CNA HHA programs just to provide me with that update. So with that said, that covers everything that was on the agenda. I believe that based on our conversation today, that there is a need to do some follow-up discussions and exploration around at least the refresher course and the needs in the area. So on that topic, we will schedule another allied health meeting. I will say that I feel like I have more flexibility now to schedule a meeting, so I'll put it out there. I'm thinking maybe 6 weeks out. Are folks comfortable with that? I see heads nodding. And I'm wondering if this time works for those of you who were in the meeting, 10:30 to 11:30. All right, okay, so I will do that on a Wednesday and I'll send you guys the invite. Thank you for attending and see you soon.